More than 1 in 5 students have seriously considered suicide, and 1 in 10 high school students have attempted suicide as of 2021 per the Centers for Disease Control. Hello, my name is Jordan Kent. I live in Sioux City, Iowa, and today, November 19th, 2023, we will be discussing the current mental health crisis in the United States. Because there is so much information on this topic, we will focus solely on the mental health crisis of our youth. Since the pandemic, the mental health crisis has only gotten worse. The purpose of this podcast is to inform the public on how severely the pandemic has impacted the mental health of our youth and to urge citizens of the United States to support pro-mental health legislation. In 2022, a warning from the general surgeon was issued on protecting the mental health of our youth. He states that there's been an overall 40% increase in students that felt a sense of hopelessness or sadness since 2009. In 2021, the CDC reports over 1/3 of high school students have experienced poor mental health directly related to the pandemic. There's also been an astonishing 57% increase in suicide rates for ages 10 to 24 since 2007. This has initiated the American Academy of Pediatrics to declare a national emergency in adolescent and child mental health in 2021. The physical lack of mental health care providers is also a crisis. In February of 2022, Mitch Preenstein, Chief Science Officer of the American Association of Psychology, presented to the United States Senate. Here he discusses the dire need for more mental health providers in the United States. Medical residents in training can bill to Medicare, but psychology residents are not able to. That is 5,000 providers in training that could be currently treating people. The United States also provides $15 billion annually to produce new healthcare providers, but only approximately 1% of that is for mental health providers. Dr. Michelle Durham, Vice Chair of Education and Department of Psychiatry and Clinical Associate Professor of Psychiatry and Pediatrics at Boston University School of Medicine, also presents to the Senate with 6 areas that need improvement to improve outcomes of poor mental health in our youth. First, we need to strengthen the workforce. Like we discussed earlier, we need more providers, whether that's helping with funding or student loans replacements, or, like we mentioned earlier, being able to bill Medicaid as a resident of psychology like the medical school residents can. We also need to improve access to mental health care. We can start doing that by having psychologists in school systems, and so students are able to access mental health care just by going to school. Next, integration of primary care and behavioral care health. We need to start realizing that mental health care is part of primary care, and primary care providers should be taking mental health very seriously. We also need to support evidence-based medical programs. There were programs put in crisis placed during the pandemic, and it's been proven that they have been successful, so we do need to keep funding those programs. Like I said, we also need to have fairness of pay and reimbursement for behavioral and physical health care. And lastly, she wants the Senate to support $1 million investment in mental health research. We as a country must see the need to treat mental health disorders as seriously as medical health disorders. The pandemic has had serious repercussions on the mental health of our youth. As a nation, we must trust the experts in this field and follow their advice to give the youth a better chance at a healthy life mentally and physically.